Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome back to episode number 276 of the Healthy Skin Show. In today's episode, we are going to unpack the problems that many Dupixent users have experienced that involve eye issues. And at the current level of research, it turns out that around 30+% of people using Dupixent are having a problem with their eyes, developing a lot of discomfort, redness, blurry vision, issues with their eyes that they never oftentimes had prior to the use of the medication. Now, when the medication was approved by the FDA, this side effect was never mentioned in any of their documentation. But now it turns out that a fairly sizable amount of people are experiencing eye issues. My team and I have been on the lookout for any information on this topic because I have received so many requests to look into this, but it wasn't until this past fall that we stumbled across information online that looked at research going on currently as to why people on Dupixent are experiencing this problem. And fortunately, after many emails, we were able to get one of the study's authors to come on the Healthy Skin Show and share this information with you. Plus, this offers you the opportunity to bring this information to your dermatologist or your ophthalmologist to get the help that you need sooner rather than later, because these side effects are generally not something, from the sounds of it, that are just going to go away or that you will get used to it and you're adjusting, so to speak, to the medication. If you are experiencing these side effects, you would need some sort of intervention from your physician team. My guest today is Dr. Roselie Achten. She's a medical doctor and a PhD student at the Department of Dermatology at the University Medical Center Utrecht in the Netherlands. And her PhD actually focuses on ocular surface disease in atopic dermatitis patients before and during Dupilumab treatment. It's incredibly neat that we were able to get one of the researchers on these papers here on the Healthy Skin Show. So without further ado, let's dive in. Dr. Achten, welcome to the show. I'm so glad you're here.
Yes, thank you for the invitation on
You're
your
welcome.
podcast.
You're welcome. I've gotten a lot of questions from listeners about Dupilumab and the side effects, specifically when it comes to the eyes. And it seems like a lot of people, not everyone, but some people do experience certain eye issues. They complain about a level of eye irritation that can develop. And I don't know, maybe you know, maybe you don't, when that may develop in terms of starting Dupilumab. But it seemed like from the research, it wasn't one of the side effects that was discussed in the sort of clinical trials in those original papers. Can you tell us why is it that these side effects are impacting the eye, and how common is it?
Yes, thank you for this first question. So indeed, the most frequently reported side effect in Dupilumab-treated atopic dermatitis patients is the conjunctivitis, and we also call it Dupilumab-associated ocular surface disease. And in the Dupilumab phase 3 trials in atopic dermatitis patients, it was reported in up to 8% to 22% of the patients, but the rates increased over time as there became more awareness of the adverse event. So it became more or less an adverse event of special interest. And also, if we look in daily practice, we see that approximately 1/3 of the patients develops the Dupilumab-associated ocular surface disease.
Wow.
Yes, and we see that approximately after 4 months of any first 4 months of treatment with Dupilumab, most patients develop this side effect.
Oh, wow. So is this something that happens like after the first I know that there's a loading dose series. Does it happen normally then, or does it seem to take maybe a little more time?
Yes, sometimes already within the first 2 weeks we see in daily practice, but it can also take a little bit longer. And usually patients present with eye complaints of both eyes. So both eyes are affected, and symptoms that patients report often are, for example, redness of the eyes, but also itch, sometimes a burning sense or pain, and sometimes patients experience excessive tear fluid in their eyes.
Any possible like visual changes or like blurry vision?
No.
Okay, so no visual issues, more so just the feel of the eyeball and the look of the eyeball. It's the white of the eyeball itself.
Yes.
Okay.
Yes.
Okay, so I should tell everyone that the reason we're having this conversation is my associate came across a Medscape article of a poster. Is it a poster, or it was a study that you're working on right now? So some things we can talk about, some things we can't just yet. But your research team is actually looking for reasons why people are experiencing this side effect with Dupilumab. So what did your study look like, and what did it find?
Yes, so indeed, our research team is looking at for reasons why this drug impacts the eye. And we have a team with dermatologists, but also ophthalmologists, and also pharmacologists, and people who do translational research. So it's a large team. So we've done different researches. So, for example, we did look at risk factors. So which patients develop Dupilumab-associated ocular surface disease and which do not. And in this study, we included 469 patients that were treated with Dupilumab and had atopic dermatitis. And of these patients, approximately 1/3 developed Dupilumab-associated ocular surface disease. Of these patients, significantly more patients had atopic dermatitis on their eyelids in the past years. So that suggests that this is an association between the eyelid eczema and the development of the Dupilumab-associated ocular surface disease.
This episode is brought to you by my skincare line, Dermaclear. The beauty of these skincare products are that they are especially crafted for those struggling with chronic skin rash issues based on my research and clinical experience from my private practice. They focus on organic ingredients that are clean like zinc, aloe, and hemp oil that support and calm rashed, dry, angry skin. There's no unnecessary chemicals or additives that can further dry out your skin or mess with your hormones. And I'm so excited for you to add these creams into your routine. Check them out at quellshop.com and use the coupon code GET15OFF to get 15% off your first order. I'll put a link in the description below, and now let's jump back to the video. So are you saying, because I want to make sure that everyone hears this, your team is considering or thinking that possibly having had eczema on the eyelids themselves could potentially put you at a greater risk for developing this?
Yes, the study that we did showed that there was an association between those two factors. Yes. And another factor that we found was that people that had a history of any eye disease and also used ophthalmic medication at the start of Dupilumab also had increased risk of developing Dupilumab-associated ocular surface disease. So, this might indicate that these patients already have ongoing ophthalmic pathology, for example, which leads to a higher risk of the development of Dupilumab-associated ocular surface disease.
Okay. Do you know, just out of curiosity, like when you say using medication on the eyes, could it be like any type of like some sort of dry eye medication or a glaucoma medication?
Yeah, so in this study it was very broad because it was already a quite small group. So if we divided it in more small groups, we could not do any analysis with it anymore. So I don't know if there's one particular medication that increases the risk.
That's interesting, though. It's interesting. It's so cool that you're digging into this. And that's at least from the get-go, that's a large group of people to even just look at. So even if we can pull out some little nuggets and then you guys can dig into this further in the future, I'm sure you're going to find even more information as well.
And we also are currently investigating the eyes by using an ophthalmology examination. So the study that I mentioned about the risk factors was based on patient-reported diagnosis. And now we're also doing an ophthalmic examination in patients that are starting with Dupilumab treatment. So this is a prospective study, and we do an ophthalmic examination before the start of Dupilumab and also during treatment. And our ophthalmologist developed a score system, the Utrecht Ophthalmic Inflammatory and Allergic Disease Score, also called the Utopia score, which focuses on the different parts of the eye. So, for example, the eyelids, but also the bulbar conjunctiva and the tarsal conjunctiva, so the eye with white part of the eye, and the tarsal conjunctiva and the limbus. And this will assess an overall severity score of the ocular surface disease, that of no, mild, moderate, or severe ocular surface disease.
Can I ask quickly, did your study look at whether this is, like, in terms of this, like, side effect, does it go away if you stop Dupilumab?
Yes, we did not do that in the study that I mentioned now, but we did a previous study in which we followed 33 case series. It was a case series of 33 patients, and we found that discontinuation of Dupilumab, which was necessary in 3 patients, led to improvement of the ocular side effects. But there's also some treatment that can be prescribed for the Dupilumab-associated ocular surface disease. Yes.
Wow. Okay, so you've really been digging into this. This is not actually your first study into this, and you're continuing on. This is really, really cool. My listeners should be familiar with the term cytokines. If you guys aren't, you should go back and listen to specifically the episode with Dr. Heather Zwicky, and we'll put that link directly into the show notes if you did not hear that, where we discussed what cytokines are, but you can think of them as signaling molecules in your body that, for those of you who know, different diseases can have an increase in certain cytokines. And so with Dupilumab, we see that it targets IL-13 and IL-4. So in your paper, I thought this was really interesting. So you said that IL-13, because it's blocked by Dupilumab, you mentioned in regards to that something called goblet cells. Can you describe to the listeners, what are these goblet cells? Like, yes, it sounds like goblet, like a little goblin running around, but goblet. Although it's not a monster, by the way, everyone listening. What do these cells do, and how might Dupilumab actually impact the cells in the eye region?
Yes, indeed, my colleagues investigated some of the conjunctival biopsies of patients with Dupilumab-associated ocular surface disease, and they found a scarcity of the conjunctival goblet cells. And the goblet cells in the conjunctiva tissue are mucus-secreting cells that are vital for the ocular surface function. And as you mentioned, Dupilumab is affecting the IL-13. And we hypothesized that because normally IL-13 has a positive effect on the mucus production of the conjunctival goblet cells and also on the growth of the goblet cells. And we hypothesized that due to the blocking effect by Dupilumab on IL-13, this might lead to less mucus production and less goblet cells. And we're currently investigating these conjunctival goblet cells in patients that are being treated with Dupilumab. We're using a technique which is called conjunctival impression cytology. So it's a very easy to perform and non-invasive technique, and you can collect the first cell layers of the conjunctiva tissue and then look at the goblet cells. So we're still working on the number of goblet cells during Dupilumab treatment. So we're already analyzing patients that are starting with Dupilumab treatment. And we found that these patients already had lower goblet cell numbers compared to healthy controls.
Interesting.
Yes, and what I also wanted to mention is that we were also quite surprised by the fact that the majority of the patients with moderate to severe atopic dermatitis already had characteristics of the ocular surface disease. So of the 70 patients that were analyzed, 90% of them already had characteristics of ocular surface disease before the start of the Dupilumab treatment, which is quite a lot.
Can I ask, you've mentioned ocular surface disease a lot, and for someone listening, they may never have heard of this before. If someone is considering Dupilumab, but they're nervous that they could be impacted this, could they go to an ophthalmologist and be checked beforehand for ocular surface disease?
Yes, that's a good question. We are doing that in our study, and we see that many patients already have ocular surface disease before the start of the Dupilumab treatment, and even 31% of the 70 patients that were analyzed had moderate to severe eye complaints before the start of the Dupilumab. And what makes it a little bit hard is that not all patients reported symptoms of the ocular surface disease. So you really need the ophthalmic examination. But we do see that, again, in these patients, we found that patients with moderate to severe ocular surface disease had more frequently the eyelid eczema and also more severe atopic dermatitis. So maybe if it's not feasible to refer all patients to an ophthalmologist before the start of the Dupilumab, we recommend to refer, for example, the patients with more severe eyelid eczema or more severe atopic dermatitis at all.
That is good to know. And I think that might be helpful for people to hear, because I know a lot of people are on the fence. And for those of you listening, you know, I am you do you. So if you feel that medication is a good next step for you, I will never judge you for that. I don't think anyone should be judged whether they choose to do meds or they choose to go an alternative route or they choose to mix both. So if you're concerned about this might be something you could do to help advocate for yourself and inform yourself about what the potential risks are, and maybe if you are at greater risk for this type of side effect. So we'll get a little nerdy for a second. In your research, and I know you're going to try and make this as simple as you can for everyone listening, because when we start to talk about immunology, you know, I will even admit, I don't have a background in immunology, and I understand so much thanks to all of the wonderful experts here on the Healthy Skin Show and my own personal curiosity. But it gets confusing. And so I read something in the Medscape paper, and then you had shared some more details with us before this interview about how Dupilumab might lead to this imbalance between the two different sides of the immune system, TH2, and then like the TH1, TH17. And this somehow could possibly feed into that concept that, remember, we talked about a moment ago, everybody, how Dupilumab impacts IL-4, that cytokine. So as best you can, if you're going to explain this to a patient listening to this, what does that mean? And how could that imbalance maybe show up just symptom-wise? Like, what would they feel in their body or see show up in terms of symptoms?
Yes. So as you mentioned, Dupilumab affects the immune pathways of both IL-4 and IL-13, which are the Th2 cells. And normally there's a balance between the Th2 cells and the Th1, Th17 cells. And due to the inhibition of the Th2 cells by Dupilumab, in some patients a disbalance may appear. And that might lead to an increase of the Th1 and Th17 cells. And we've already seen this in some case reports describing that during the Dupilumab treatment, other Th1 related adverse events could appear, for example, psoriasis. And our hypothesis is that the disbalance that developed, the disbalance between the Th2 and Th1, Th17 might lead to a Th1 inflammation in the eye. And my colleagues already investigated some biopsies of the conjunctiva tissue of patients with the Dupilumab-associated ocular surface disease, and they found an increased local Th1-related cytokine production in the biopsies. But this was very small study, so we need to learn more about this and need to do a larger study, and we will conduct that later on.
Oh, wow. Well, at least it's helpful to know, I think, for everyone listening who has maybe even experienced this side effect, it's not in your head. Something's going on. It's a clue that there's some sort of imbalance going on. I think it's helpful for people to hear. So in terms of, you'd mentioned discontinuing Dupilumab can be helpful in at least reducing the severity of this ocular surface disease that shows up in some individuals. If, say, you want to stay on Dupilumab because it's really helping you, but this is like the one thing that's driving you nuts and making you not feel great, is there any way to treat it or manage it while you're on Dupilumab that you know of?
Yes, and maybe it's good to know that most of the patients can continue Dupilumab, regardless of the Dupilumab-associated ocular surface disease. So only few patients need to stop with their treatment. So the majority of patients can continue their treatment. And what we already always do, if patients have these signs and symptoms of Dupilumab-associated ocular surface disease, we first start with tacrolimus skin ointment for the external eyelids. And we also start with ketotifen, which is an antihistamine eye drop. And some
yes, ketotifen is also ketotifen's also helpful for stabilizing mast cells. So I'm familiar with this, and I think some of the listeners may be too. But that's good to know.
And also the artificial tears. It's more for if you experience a dry eye sensation, it could lead to improvement of that symptom for a little time, because it's not improving the ocular inflammation. And if that's not helpful, then we recommend to refer the patients to an ophthalmologist.
And the person who would prescribe this, so for those listening, they know my dad was an ophthalmologist and an eye surgeon, so I understand most of the things, probably the words and terms that you've used, I probably understand more than most. If you are experiencing this issue, I think most people, the first phone call they're going to make is to their dermatologist. Does the dermatologist prescribe these eye medications, or?
Yes, in our outpatient clinic, all patients first call the dermatologist indeed, and we prescribe the tacrolimus and the ketotifen and the lubricant eye drops, the lubricant eye drops. And sometimes we also prolong the dosing interval of Dupilumab. So, for example, once every 4 weeks or once every five weeks, we see that the inflammation becomes less if we taper down the dose. We've described that in a case series of 33 patients, so that's also an option if for example, the tacrolimus and the ketotifen are not working or the medication prescribed by the ophthalmologist is not effective enough.
Okay, so right now it sounds like the treatment option, if you want to stay, I just want to recap for everybody listening, if you want to stay on Dupilumab, would be some tacrolimus. It sounded like cream, like you would apply a cream to the eyelid. And just for everybody listening, please talk to your doctor in case you have some tacrolimus cream. I just know some med formulations are not appropriate to be put around the eyes. I know that from my dad, working with my dad in his office. So just check with your doctor. Don't go and put things around the eyes if you weren't advised to, because sometimes they can cause damage to the eyes, and the eyes are kind of like an extension of your brain. So just keep that in mind. So talk with your doctor. So tacrolimus cream, ketotifen eye drops, and then you said dry eye drop, those hydrating eye drops for dry eyes. And then possibly, instead of doing your shots, I think, what are they normally every 2 weeks? Yes. So every 2 weeks, you would perhaps space them out further to once every 4 or 5 weeks. But obviously you would do that in conjunction with your doctor and their advice. Don't ever change your medication without because this is a biologic drug. We don't want to start messing things up and nobody knows what's going on and taking medications or stopping medications without their support and help.
Yes, and sometimes the ophthalmologist can also prescribe some therapies that are more effective. So if the tacrolimus, for example, is not working, then first go to the ophthalmologist. And if that's not working, you can think about prolonging the interval dose.
Perfect. Well, thank you so much for sharing all of this, Roselie. I honestly was so thrilled when I saw this paper. I'm excited for the research that you're doing. So I hope that you'd be willing to come back once you have more data to share with everyone. I know everyone's going to appreciate this so much that you're actually looking into this, because I think people have felt like this was a really big side effect that there really wasn't that much information coming out about. And it's very refreshing that we finally have some info that also patients could bring back to their doctor if their doctor is not aware of what is going on with the eye side effect. This could be a really great resource for them. And I will link to the Medscape article in the show notes so you can also share that with your physician. But thank you so much for being here. I really appreciate it.
Yes, thank you for the invitation again.
I really truly hope that this episode is helpful to you. Please make a point to share this episode with people you know who are on Dupixent, especially if they are experiencing these side effects from taking Dupilumab, or as you may know it as Dupixent. The episode, all of the research linked up, and any way that you'd like to contact Dr. Achten can be found in the show notes over at skinterrupt.com/276. And if you obviously have any questions or comments or experience with this, leave your thoughts there so we can keep the conversation going. And if you find information like this so valuable and helpful, but haven't yet rated or reviewed The Healthy Skin Show, head to your podcast platform of choice and do that. I know that everyone who looks at those reviews would really appreciate your 2 cents about what you find valuable about the show. And then hit the subscribe button so you never miss a weekly dose of the latest research, inspiration, and strategies to help you rebuild healthy skin. And let's connect over on social media. I'm at Jennifer Fugo. Thank you so much for tuning in, and I look forward to diving deeper with you in the next episode.